So today we're going to be talking about Iberogast, which is an herbal preparation that's been studied in IBS and related conditions. And to be totally honest, even the phrasing of herbal preparation kind of freaks me out. I mean, it's like, as a dietitian, I've done various types of clinical roles. You know, I've worked with organ transplant patients. I've done the medical nutrition therapy education about food, drug, nutrient, herbal kind of interactions. And so it's always top of mind that, you know, these sorts of herbal things are not totally inert substances that we need to be careful with because things can go wrong, especially because we just don't know a whole lot about what they do, how they work, if they're safe, that sort of thing. But Iberogast is one herbal preparation that's out there that does seem to have a little bit more evidence than many other products that are available. So we're going to talk about that a little bit more today, but I just want to make it clear that absolutely nothing I'm saying here should be misconstrued as medical advice. And please, never, ever, ever, ever take supplements, but particularly herbal supplements, without first talking with your medical provider. So what is Iberogast and how does it work in IBS? So Iberogast is a liquid herbal preparation that has been made and used in Germany for over 60 years for treating gastrointestinal complaints. But more commonly in the literature, we've seen it referred to as STW5. Now answer me this. How do you go from the name Iberogast to the name STW5? These are very different names, right? Like, where is this whole STW thing coming from? What does that even stand for? So this question absolutely drove my colleague Ashley insane, who spearheaded this whole research project. And she was trying so hard to figure out where the whole STW thing came from. So she actually reached out to Bayer, which is the company that owns Iberogast, to ask them about this phenomenon. And even they didn't know. But that didn't stop Ashley. Her next step was to come up with an idea of what she thinks it might stand for. So basically, Bayer acquired Iberogast from a German company that was called, hold on, I'm going to pull up my list here. And German people out there, don't judge me because I cannot pronounce this to save my life. It was called Steigerwald Arzneimittelwerk. It's the best I'm going to be able to do here. But we think that the STW probably comes from the Steigerwald part, so STW. But we're not sure about that. So anybody out there who knows the backstory of how the technical name of STW5 came about, please let us know. We would really love to find out that information. So definitely make a comment below if you happen to be someone that knows. But back on topic here, we were talking about what Iberogast is. So it's made up of a preparation of 9 different herbal extracts. So those extracts come from bitter candy tuft, angelica root, chamomile flowers, caraway fruit, celandine, licorice root, lemon balm leaves, milk thistle fruits, and peppermint leaves. We also came across another form of Iberogast called STW52 that was kind of the same preparation, but it didn't have the celandine extract in it. And when we were looking into that one, it seemed like it had some additional names like Iberogast N or Iberogast Advance. But good luck if you want to find that in the States. We found, I think, one supplier that would ship it over from Germany to the United States. And it was something like $75 for 3 ounces, pretty much triple the price of normal Iberogast. So probably not worth it. Now, as for how it works, I'm going to refer to my notes here so I don't botch this, but it appears to be a multi-target treatment. So what do I mean by that? Basically, it has dual action where it can either have an antispasmodic effect that relaxes GI muscles, or alternatively, it can also help to improve GI muscle tone to normalize gut motility. And there's also several ways in which it may lessen pain signaling. So for instance, through anti-inflammatory effects, through improving intestinal permeability, or by influencing the gut microbiome, just to name a few. So what does the scientific evidence say about Iberogast for its use in IBS and related conditions? So basically, for IBS in particular, we only have one randomized placebo-controlled trial of Iberogast in this patient population. Now, we also have some additional evidence from observational studies and things of that nature, but as far as gold standard research goes, it's just this one. So this particular study was published in 2004. It included 208 individuals with IBS, and it was a 4-armed study. So there was an STW5 group, an STW52 group. So that's the type of Iberogast that doesn't have celandine. There was also a bitter candy tuft group, which is another herbal extract that's in Iberogast. And then there was a placebo group. Now, the 2 STW groups in this study received 20 drops of Iberogast of some form 3 times per day for the 4-week duration of this study. And the primary outcomes evaluated in this study were changes in abdominal pain and global abdominal symptom scores. So in this study, there were significant differences that were seen between the placebo group and the 2 STW groups. And that began as early as 2 weeks into the trial, but became even more pronounced by the end of the trial after 4 weeks. When it came to abdominal pain, roughly 30 to 50% of those in the Iberogast groups had complete relief of their abdominal pain. And that variance in those numbers was related to the quadrant that was being measured for abdominal pain. They were looking at like right upper quadrant, left, that sort of thing. And then for global abdominal symptom scores, there were significant improvements at the day 28 measurement, so the end of trial measurement, with a symptom score improvement of 54% for the STW5 group and a 57% improvement for the STW5-2 group. And the symptom scores measured as part of this score were flatulence/meteorism, so almost like this sensation of trapped gas. And then incomplete evacuation, bowel habits, so things like diarrhea or constipation, for instance, sensation of tension or fullness, and abdominal pain. Overall, in this study, there was a 15 to 25% therapeutic gain over placebo with the STW5 and STW5-2 groups, with complete relief of symptoms being achieved at a rate more than 50% greater than what was achieved in the placebo group for virtually all symptoms. Even more, physicians rated the efficacy of STW5 in this study as good or very good in 64.7% of patients, and they rated the efficacy of STW5-2 as good or very good in 72.6% of patients.
Before we continue, I want to quickly tell you about IBSprobiotics.org. So this started out as a research project, but then we ended up turning it into this really cool comparison tool. When you go on the site, you can easily compare which probiotics were most effective for different IBS symptoms, all exclusively based off of clinical studies. In fact, we spent the past 2 years building it, having analyzed over 50 different probiotics across more than 75 placebo-controlled trials. And the results surprised us. For example, we found that some really popular probiotics were nowhere near as effective as some lesser-known options, and there were even some probiotics that seemed to do more harm than good. So I hope this free tool helps you to cut through the marketing hype and saves you a ton of time when evaluating a probiotic.
Now, when it comes to related conditions where Iberogast has been studied, the one that comes to mind the most is something called functional dyspepsia, which is basically this functional bowel disorder, same classification as IBS, that results in an upset stomach and can have symptoms like feelings of early fullness while eating, burning sensations in the stomach pain, belching, nausea, just to name a few. And there's no known structural cause for any of those kind of issues that's going on in functional dyspepsia. So while this is a distinct condition from IBS in some ways, there's actually a lot of overlap that can happen amongst functional bowel disorders, including between IBS and functional dyspepsia, so much so that there can be upwards of 30% of people who have symptom or syndrome overlap. So we felt like the functional dyspepsia evidence, while not all about IBS, for instance, still is relevant to the IBS population, given that these are similar conditions that can have so much overlap. So just to give an example of some of the evidence that's out there on Iberogast for functional dyspepsia, there was a 2004 meta-analysis which included 4 trials, 3 of which were randomized controlled trials, RCTs, and 1 was a non-inferiority trial, which is basically just a study that compares a new treatment up against an old active treatment that we know works to see if the new treatment is comparable or at least not worse than the active treatment. So for the 3 RCTs that were evaluated in this study, they conducted a pooled analysis. And what they found is that 60% of participants in the Iberogast groups from these studies achieved symptom relief that they rated as either mild or absent, compared to only 24% of the participants who were given a placebo achieving that outcome. They also found that 6 out of 10 symptoms assessed were significantly associated with treatment, including improvements in abdominal cramps, epigastric pain, nausea, acid regurgitation, retrosternal troubles, and vomiting. In the non-inferiority study that was analyzed as part of this meta-analysis, both STW5 and STW5-2 showed equivalent efficacy for managing functional dyspepsia, as the comparator drug cisapride, which ironically enough was actually pulled from the market later on due to cardiac side effects. It's also worth mentioning that we saw observational studies and also retrospective surveillance studies of Iberogast in IBS and or related conditions like functional dyspepsia. And it was common to see patient and physician judgment of the intervention of Iberogast in these trials as being good or very good in a range of about 80 to 96% of participants, depending on the study. So that's pretty high. And some of these studies were fairly large. So for instance, there was an observational study that was done in IBS participants with over 2,500 participants, and a retrospective database surveillance study in children with gastrointestinal complaints, including functional dyspepsia and IBS, with over 40,900 participants. So of course, this is not gold standard research. It's not a randomized placebo-controlled trial. There aren't placebo groups in these trials. But still, it's compelling information nonetheless, given the scale of these studies, and the findings do seem to align with the evidence that we see from more controlled trials. So the key takeaways when it comes to the evidence for Iberogast in IBS and related conditions is that Iberogast has been shown in clinical trials to help improve symptoms such as flatulence, incomplete evacuation, bowel habit disturbances like diarrhea and or constipation, sensations of tension or fullness, abdominal pain, abdominal cramps, nausea and vomiting, and acid regurgitation. And then efficacy ratings of Iberogast as producing a good or very good treatment outcome are high. And these ratings range from 64.7% to 96% of patients achieving this degree of clinical benefit, depending on the study design, the form of Iberogast used, and the population studied. Now, when it comes to the safety of Iberogast, safety monitoring from clinical trials and observational studies in children and adults have shown a very low incidence of adverse reactions to Iberogast. So generally, it does appear to be safe. So for instance, a review article which looked at different studies on Iberogast totaling over 50,000 participants found the incidence of adverse reactions to be around 0.04%. So one thing to consider if you are on the fence about trying Iberogast, or if your medical provider is a little bit anxious about the idea of an herbal supplement, which is totally understandable, would be to maybe work collaboratively with your provider and monitor different laboratory values to ensure that you are responding to this supplement safely, if that is something that your provider would be open to. Now, finally, if you have gotten the green light from your medical provider to take Iberogast, we're going to talk about how you would go about doing that. So the manufacturer of Iberogast, which is Bayer, recommends the following dosing. So they suggest that adults and children over 12 years use 20 drops or 1 milliliter 3 times per day, and children 6 to 12 years use 15 drops or 0.75 milliliters 3 times per day, and then children 3 to 5 years use 10 drops or 0.5 milliliters 3 times per day. They also recommend taking it before or with meals, making sure to shake the bottle before each use, and dispensing the drops at a 45-degree angle into an ounce or two of warm water or another beverage of your choice. Most studies were at least 4 weeks long, so we would suggest giving it a trial of at least that long before deciding if it's working for you or not. Of course, if you have approval from your medical provider. And with that said, one observational study that we came across found that people were noticing the effects as soon as 15 minutes after having taken it, with most participants noticing relief within 60 minutes. So it may have fairly rapid effects, and you may not have to wait that full 4 weeks to get some relief if it helps you. And one thing I want to point out is that it can be a little bit challenging to find Iberogast in the United States. You're probably going to have to order it online. And then when it comes to the Iberogast Advanced version that doesn't have celandine, that is next to impossible to find here. You would have to have that shipped over from Germany, and it's probably going to be a lot more expensive. So it may not be as practical of an option. And that's all I have for you guys today about Iberogast. But if you have any questions about this supplement, or if you want to share any personal experiences with trying this supplement, then please be sure to leave a comment below for us. We would love to hear from you.
Thanks for watching this video. And as a quick reminder, don't forget to check out ibsprobiotics.org. We're really proud of this research project turned comparison tool that we've made. And of course, it is free and publicly available. And if you want to keep up to date with the latest IBS research, you can follow me here. See you next time.